So, welcome back to another episode of Ingredients for a Better Life. I'm DNA Chef Jay, joined here weekly by Dr. Nettles, founding father of Stop and Regrow, chief medical scientist. Doctor, good to see you. How are you making out this fine, beautiful day?
Great to see you, Chef Jay. Another beautiful day down here. Today better than yesterday. Tomorrow better than today. So we're sticking around.
All right, to get right to it, one of the top searches on Google for hair loss, can hair loss be a sign of something serious? So, that's a very, very good question. We know hair loss is a cosmetic indication of something going awry in our Nile River, something deeper going on inside. So it's like a red flag of saying, hey, something's not going on here. That's, that we know that much. And we know in the past, you've had certain patients that have come in and they did have something wrong with them, and you sent them to a specialist and they were able to get the care they needed. So let's talk about why regular blood work is the key to kind of keeping our diagnostics of that Nile River in check, and why they're so important. If you can maybe go over some of the tests that are in that.
Very good question there, Chef Jay. So the question is, hair loss is a symptom of another serious disease. Can it be? And you're right, hair loss can be associated with a serious disease. I think you first think, I think all diseases are serious, okay? Because all diseases happen because of something that's abnormal, right? Something that is outside of normal. And if we can figure out what caused any disease, then I think that is beneficial. So hair loss, people come to see us for hair loss, and then they stay for health. That's what they say. Doc, I came to see you for hair loss, but I stayed for health, because they start to realize that hair loss, as you mentioned, is an indication of your overall health. So when you lose your hair, you are definitely not as healthy as you were when you had hair. That's a fact. From a molecular standpoint, you are healthier when you have hair as opposed to when you don't have hair. Now, there are some bodybuilder types out there, Chef Jay, that walk around with a six-pack of abs and a bunch of muscles, and they got no hair on their head, and they'll tell you that they're healthier today. And that's not necessarily true. Now, that's usually when people overdo the testosterone, like an Arnold Schwarzenegger. You can change your body and turn it into something else, and then you could hide the underlying cause of the disease. And that's what you're talking about here is, so hair loss is like the tip of an iceberg. So you're right, Chef Jay. Everybody, once you see that you no longer have the same hair as when you were 18, and unfortunately, Chef Jay, that's happening as early as age 16. So 16 years old is going to be the pinnacle. That's the top, thickest hair that you're going to have on your head, age 16, okay? So from that stage, you see me today, Chef Jay. My hair today is as thick as it was when I was 16 years old. Now, when I was 16 years old, I had a six-pack. I'm 50 years old. I still have a six-pack. Now, that has a lot to do with nutrition and exercise and lots of other things. But when I was losing my hair, I was not in as good a shape. I didn't have my six-pack. I was softer. I didn't have the tone. My skin didn't look as good. I had acne. I had oily skin. I had perspiration issues. So there are lots of problems that go along with diseases. So when you see hair loss, that's not the only thing going on. You just have to put them all together. But a lot of times people don't think about their acne getting worse or getting better, or their smell of their odor getting better or worse, or the texture of their skin, or the oiliness of their hair. They think it could be the shampoos they're using, right? So, or the types of foods they eat. So it is a very tricky place to be down here on Earth without knowledge, okay? And the only knowledge that you can get about the human body comes from the blood, right? The oldest book ever written, the Bible, Leviticus 17:11, the life of the flesh is in the blood. So God told us early on it was in the blood. It took my hard head 10 years of learning traditional medicine before I went back and just started, went back to the basic sciences of chemistry, biology, physics, genetics, nutrition. And then, of course, God was right, always is right, Chef Jay. The life of the flesh is in the blood. Now, the second, after the judgment, you have an afterlife, and that time you've got a spirit body. I don't know if the flesh is going to have blood, but on earth, the flesh survives because of the health of the blood. And you reference the blood as the Nile River. You better believe it. So let's use that analogy. So if the blood is the Nile River and the blood touches every cell in the body, then the blood is responsible for the health of every cell inside the human body. 100 trillion cells. You and I are the experts on earth at understanding and discovering the causes of diseases found inside the Nile River, the bloodstream.
So getting back to the biochemical report card, or the DNA blood test, as you call it, so I'm taking from this then that it's not only for diagnostic reasons, but it's for prevention as well.
You're right, Chef Jay. That the BRC Biochemical Report Card is a report card. So just think when kids are in school, they get report cards every 6 weeks, and then when you go to college, you get it once a semester. But report card. So I like to think of the blood report card is something that humans on Earth should do once a year. Now I know a lot of times people get blood work done. And there's the problem, Chef Jay. Until you know what to look for in the blood work, you can't just order blood work. And unfortunately, in the United States, you have a general health panel. And Chef Jay, that general health panel cost about $22 at the lab companies. So they've got $22 worth of biomarkers that they're looking at. And unfortunately, for $22 in a general blood work panel, you cannot determine much of anything. But with our extensive biomarker review diagnostic test that we have, we can take a peek at lots of organ systems. We can take a peek at the liver. We take a peek at the kidney. We take a peek at the prostate. We take a peek at the thyroid. We take a peek at the cells, the red cells, the white cells. We caught a patient 2 weeks ago that we found a myeloblast inside the bloodstream, and you can't have those there. So that's a myeloblast that came from a bone marrow that was telling us that the patient could have a bone marrow cancer. Okay, so a leukemia type of cancer can be found in our bloodstream. So the patient's thrilled that we're able to help him regrow his hair. But after reviewing his blood work once a year, after 2 or 3 years, we start to see a trend. And we caught the trend reviewing our annual blood levels. And now we've sent the patient over for further review with his primary care so that they can really follow up and make sure that the patient doesn't have cancers. And we see that happen quite often as well. So we're treating hair loss, but we're actually looking at quite a few things. We're doctors. We're not like the Hims and Keeps. They're just a marketing company, right? They've got a doctor on dial-a-phone, and then they've got a marketing team. So we're real doctors, and we've got real pharmacists, we've got real medications, we can treat real diseases, and hair loss is a real disease. It's a metabolic disease or disorder, and that's going to be very difficult for a skin doctor, a dermatologist that treats things topically or surgically. It's going to be very difficult for that person to understand biochemistry and molecules. So it seems that you'd need an endocrinologist to work on the biomarkers that deal with the hormones, and then a nutritionist to cobble together the micronutrients found in the other part of the blood work. So, Chef Jay, we can see lots of things inside the blood work. So you come for hair and you stay for health.
So on my side of the fence, let's talk about the fear of the biochemical report card blood test, or the fear of the white coat anxiety. You know, a lot of people just don't like the doctor. They were afraid of the doctor for whatever reason in their past. I know that you also have studied human, behavior as well. You have a master's degree in that. So what is it in us? And I was this way when I came to you years ago as well, that I speak with so many guys, they're like, look, I don't want to know. I'd rather not know than have something, like, I don't want to know if I have cancer. I'd rather just ignore it. But like, what do you say to that general population? Because obviously that's not the right way to do it. There's two types of people in the world. One type of person will take action, another type won't. But how can you speak to this fear of the white coat and the fear of them finding out something, dire in their blood work?
Well, the fear of the unknown. And the problem is, Chef Jay, most people know that something's wrong. And that's why they don't want to get the blood work. So when I was a medical student, we came across a female that had breast cancer. And, if women just examine themselves, they can catch these things before they get too big. And what size was the tumor that we found on this woman? Size of a volleyball. So it was not that she didn't know. She did know, but she was so scared of death that she didn't want to get the diagnosis that was going to tell her that she was closer to death. So they'd rather not know. But I think there's fear of the unknown. But I think, Chef Jay, today there's a lot of this where people don't want to know the future, and they don't want to believe that there's a heaven and a hell and an afterlife, right? But both of those are true. So a lot of times people just don't want to know that there's a truth out here, because then you have to be responsible, right? And then you're going to be held accountable. So with health, there's no excuse, absolutely no excuse. Every single so in the United States, I think this is what's funny, Chef Jay. So in the United States of America, everyone was mandatory, forced to have health insurance. And I don't know what the average is, but I think it's $400 or $500 a month. So call it $6,000 a year. And it's not mandatory to get your blood test. So it's mandatory for you. It's mandatory for you to pay for something, but it's not mandatory to actually get healthy. So what is it? Well, Chef Jay, it's all about money. So unfortunately, the United States is not about health. And the average person is not interested in health. They're trying to take care of their lives and just pay their bills, keep their jobs, stay out of trouble. So there's so much stuff going on in life that it's just difficult. And most people, unfortunately, are going to miss the rocket ship to hair.
Yeah, and those blood tests you speak of, if they did go and get their blood work, they're not the panels that you're looking for anyway. They're not.
You couldn't learn anything, Chef Jay. You couldn't learn anything. So if you don't ask the right questions, you don't get the right answers. And a lot of times the doctors don't want to see a lot of bad stuff, and the patients don't want to see a lot of bad stuff. So if you order the least amount of tests, both people are pretty happy. Doc says, you look pretty good. You're within normal on most of them. Patient says, good, doc. That's exactly what I thought. You and I are about the same health, both fat and out of shape.
And I know your test for the biochemical report card is what, 109, 110 panels, or what is, I think 106 tests over 9 panels. So what does that mean to the average? Explain that to someone like me that doesn't really know. What do you mean? What are 9 panels? What are these 106 tests over 9 panels? Like, what does that mean, 9 panels?
Yeah, so Chef Jay, the panels and the way you describe it, I have like just throw it on off to the side of the road. That's really not the important part. The most important part to understand is it's every test that I, the doctor, want to know about you, the patient, and that's what you have to know. You have to trust that the physician cares enough about the patient and has created a body of tests to diagnose just about anything. And from that one test, Chef Jay, we can go a lot deeper if we need to. But without that first superficial, deep enough dive into the blood work, you're just getting too superficial and you're not getting enough information. So once again, I think everyone should get their biochemical report card. It's 9 panels, 106 different tests. And we should maybe put that up somewhere for them, Chef Jay. Everybody on earth should walk in and ask their doctors for this BRC. Even if they don't get it done through us, they could have their doctors run the test for them. And then once they have the data, all they have to do is send it over to you, and then you and I can get them started on the hair program.
And maybe one day, when will the medical schools start teaching prevention and not teaching out of the same, curriculum that they were teaching in the 50s? It seems like a lot of primary doctors, internal medicine doctors don't really have the understanding because they're not taught it. So unless you seek out a specialist, a prevention, specialist like yourself, you're not going to gain the knowledge of these, what you test for, and people get left behind. Whether that's intentional or not, it's a different conversation. But for our viewers, we like to believe that our viewers are more informed, and go to stopregrow.com and just invest in yourself and get the biochemical report card, and you'll be glad you did, because like myself, you'll find things that are out of alignment that are pretty easy to get back into alignment with some work and some assistance from you. So thank you, doctor, for all your hard work and research that has gotten us here, and for giving us not only great hair, but vitality and prevention of the future. Heart disease, diabetes, no need to be part of that anymore if you can identify the things inside and take action. So thank you, doctor, for joining me today, and we'll see you again next week.
You got it. Thank you, Chef Jay. I appreciate you.
Okay, God bless.
Thank you.